Causes to temporomandibular dysfunction. So as I've established before, your TMJ is the joint right here, and symptoms can be limited range of motion, popping, pain, headaches, so on. So what are some of the common causes and less well-known common causes of temporomandibular dysfunction? The first one is trauma. This could be from whiplash, impact in sports, taking a fall. So direct trauma to your head, neck area will impact this. Stress. So what we see is people clenching, sometimes clenching at night, long-term stress. And also what happens is when we're stressed, we tend to breathe through our shoulders, and this creates all this tension in here. And over time, that can develop into TMJ dysfunction. Dental procedures. So when you have to have your mouth open for a long time, that can aggravate your temporomandibular joint. And you have to think the disc is here, and it's not your typical joint. It does this movement. So this is your mandible, this is your temporal bone. This is what happens, and right here is a disc to facilitate the movement. It's not a normal ball and socket joint. And so because of that glide and then flexion extension, when we're held in wide open positions, it really aggravates the joint. Postural imbalances, this is a big one. What I see a lot, since we work a lot at our desks and we sit a lot for a living, is this posture. So forward head posture, rounded shoulders. This is going to eventually cause imbalances in your TMJ. You don't always feel it. Sometimes you don't have imbalances, but it is a common cause. So bringing the shoulders back and down and bringing your neck back in alignment really helps relieve some of the tension in the articulation. Sacral, pelvic sacral misalignment. So your sacrum, yes, all the way down at the base of your spine, is also a unique joint like the mandible. It's a triangle, and it has two articulations, one bone. And if there's an asymmetry there, it will cause problems on either side. So we often hear of SI joint dysfunction, sacroiliac joint. When the pelvis or the sacrum is off, it can work its way all the way up the spine. The body will always try to keep the head level, so we're not walking like this. And in doing so, it'll work its way all the way up to our TMJ. Also, fascially, there's a connection. So we have all the structures that are around our spine, so the dural tube, fascially is all connected, and it goes all the way up to our occiput, and that can also cause misalignment when there's misalignment at the pelvis and sacral area. Neck dysfunction. So if you have neck dysfunction, degenerative disc disease, slip disc, anything like that, it's going to cause misalignment. It's going to cause stress on the structures in the area, which can cause imbalances and then also result in TMJ dysfunction. And then bite imbalances can also cause TMJ dysfunction. Bite imbalances, clinically, what I've seen often is related to the posture of the body as well. But things happen, and if you don't have good occlusion, then it can impact your TMJ. So these are some of the causes that I've seen in my practice that are well documented. And next I will be slowly showing you home care. I have a whole slew of great home care that I give to clients on a regular basis that I recommend and that you can start using today. If you have any questions or comments, please leave them down below. I love answering your questions and helping you understand these super common conditions that are very solvable with a little help from a manual therapist, or on your own. If you're very motivated, you can do a lot of the work and get pretty much 80 to 90% cleared on your own if you're prepared to invest in your body and in your health. All right, thank you so much for following. Have a great day.